So, welcome everyone to the case discussion series. We have the 13th case discussion series in progress right now, and I'm extremely proud and excited to be welcoming Hetal Parekh for this case discussion. With a total experience of 9 years, Hetal has a certification in on-code deglotology. She's a level 1 speech trainer and she's Vital STEM certified. She has also organized and conducted webinars and drives for awareness of speech and hearing problems through the country. She's also a part of the SLP Quest team. So, thank you, Hetal. Thank you to the entire audience who come and who support this, that we have reached the 13th in the series. All these are available in the website. I'll show you that once Hetal's discussion is done. So, thank you everyone for being here. Hetal, please share and start with the case.
Good evening, everyone. Firstly, Debosmita ma'am, thank you so much for having me here.
Thank you for accepting, working the case and getting it to all of us.
Yes. Thank you so much. So today I'm going to discuss a little about childhood apraxia of speech, the diagnosis and the misdiagnosis of the same. So it was a very interesting case that I came across about a year ago. So we start with the basic introduction that it's a motor speech disorder. That in where the children have difficulty planning, coordinating, producing, and sequencing of speech sounds. It also interferes with the child's ability to say sounds and to combine them into syllables, words, phrases, and conversations. So it can be because of any neurological impairment, or it can have a idiopathic neurogenic cause. It was first recognized by Asha only in 2007, so it's not that old actually. So coming to the case details, the kid came to me when he was around 6 years of age. And the complaint that the parents told me that he is not able to speak age appropriately. And then according to the history, like he had no significant medical history, his delivery, pregnancy, postnatal, everything was normal. Even his motor milestones were developed age appropriately. Speech milestones were definitely delayed. So when I first saw the kid, he actually came to me with the diagnosis that he has been diagnosed with speech delay, like developmental speech delay, just plain DSL. That is what the parents told me. And one of the occupational therapists had also told him that he has global developmental delay. That is why the speech delay is coming. But then it was actually not fitting how the kid was responding. So we did a thorough analysis of the like normally we do OPME and everything, but then for the kid it was like something is missing. He's not a plain DSL kid because he is a very smart kid. He has not been to schools till the age of 6 years because none of the schools were accepting without shadow teachers, and the parents were not in a condition to afford a shadow teacher. So they had put him into a special school, and nobody has taught him reading, writing, or any academic things. Normal daycare he used to go for around 2 to 3 years, and so there only he learned whatever he picked up. But still, at the age of 6 years, he learned on his own, and the kid could actually read. If you know the content, you will understand that yes, he is reading correctly. So we did a thorough assessment of his OPME. So everything like the movements, imitation of movements, everything was normal. Even the strength and the range of movements was very good. His chewing, sucking, blowing was a little weak, but it was acceptable. It was not something that could be, that was very remarking or very evident. And his muscle tone was normal, tremors were absent, there was no involuntary movements. He had no peculiar food choices. In fact, he was exposed to, coming to the language part, he was exposed to Hindi, English, and Marathi. And he was good in understanding all the three languages. He could, there was a slight delay in comprehension. He couldn't understand the higher language skills as compared to the other 6 year olds. Complex sentences was a little difficult for him to understand, but not a significant delay. Command following, single step, bi-directional, they haven't really tried. So the parents were not really sure whether he follows bi-direction or not. When I tried, he was okay with, but he required repetitions. So at that time, we could say that they were still emerging. Attention was dual channel. He could tolerate adult intervention. Imaginative play was there. And then he was trying to interact, usually non-verbally, with his peers. But he was very good in his non-verbal communication. He used very good iconic gestures. And he could actually tell you the details of the day using gestures. And nobody taught him. He picked up on his own. So he was very good with that. But what other thing that we saw during his assessment was there was some groping behavior that was seen when I was asking him to repeat few words or say few words. So what happened is he was calling his mother mama. So when he was able to say, when he wanted to say mama, he was able to say mama. I asked him, where is mama? He pointed at her, at his mother. But when I asked him that who is this, he wanted to say mama, but he couldn't. So that was actually the alarming sign that on demand, he was not able to say the words which he wanted to say. But spontaneously, automatically, yeah, those words are actually coming to him naturally. And then we worked on, like, we tried imitate for him for imitation of sounds, but that was also difficult for him. But imitation of actions and facial expressions and all that, he could really do it. There was no issue in that. His voice was normal. Even the auditory skills, they had a Bera in 2019, so it was all good. So here, the interventions that he had taken, he had not gone to a speech therapist at all before he came to me. He was referred to one, but he took 1 or 2 sessions with a speech therapist, but he couldn't continue for some reason. But he had taken rigorous occupational therapy, like around 6 to 7, like almost every day of the week. So he used to go for, sometimes he used to go twice in a day as well. And so that was a little different because nobody actually guided him that he had actually apraxia of speech. Everybody was treating him just as a normal GDD or a DSL case. But he was not, the speech wise, he was not actually progressing a lot. Vocalization had improved. That was because of his growing years. But speech wise, he was not, because he did not go for any speech therapy. Then finally, one of the occupational therapists, they referred it, then the kid came to me, they referred it to me. And then we started doing the analysis. And then we had to, like, really, after he started coming for therapy, we did his analysis, we actually differential diagnosis वगैरह सब किया, and then we come to know that it is actually childhood apraxia of speech and not a GDD case or not a plain DSL case. The biggest task over here was to explain the parents what exactly was happening with their kid, and and to explain the occupational therapist as well that they need to stop the occupational therapy. Because the child did not have any kind of hyperactivity. The child had very good sitting tolerance as compared to any other 6-year-old. He had good fine motor skills, gross motor skills, no sensory disruption or nothing irregulation or nothing of that sort. So that was a task to explain the occupational therapist that he actually does not need OT and we have to go further with remedial education or speech therapy as such. So finally, they have started with remedial education after lots of counseling, and speech therapy has been going on since a year. And he's still in special school. So initially last year, when we had asked them to go to for an interview in a regular school, the schools were not so open because he was not so verbal. He was using a lot of iconic gestures, so he was not verbal. So that is why the schools were insisting on shadow teacher, but the parents could not afford it, so they continued with the special school. But now he's at a stage where we can actually, put him into a regular school, and the school should not have a problem. So initially, it was diagnosed as DSL because it is very easy to misdiagnose it. There are lots of similarities between CAS and DSL. First is the age range. It's usually in the childhood period. They have difficulty pronouncing consonant sounds. Both the uh, kids with both the disorders have the same problem. Definitely, there was a delay in language, and expressive language was also a problem. With DSL, they have problems to means read, spell, write, everything. That is also a problem. And social language and pragmatics is also a problem. So there are lots of similarities. Sometimes I've seen apraxia of speech has been diagnosed as dysarthria as well and phonological disorder as well. But the main differential factor is their errors of apraxia of speech are inconsistent. And they have their automatic speech is good, and it is usually easier than when you do it on demand. So that's a difference. So that difference, if we can find out, then we can definitely, it helps us towards diagnosing of apraxia of speech. because dysarthria has a very significant factor of motor control, difficulties in motor control, like chewing, swallowing, everything would be affected. But that was not the case with this kid. Definitely, when you see him, talking, you will feel that the motor there is some issue with the motor control, and he's not able to say it properly. It will sound like a person, like, when an adult speaks with a dysarthria, like the slurred speech and all that. It does sound like that. So usually you first tilt towards, okay, it might be dysarthria because you have been more exposed to it. So we ruled out that also. We did a lot of cranial nerve testing as well. So dysarthria was out of question. So then next, how did we finalize that? Yes, definitely it was apraxia of speech, because we looked into the other characteristic features as well. The first was articulated grouping, which he definitely have during that time. Consonant distortions were also present. He had difficulty in movement transitions from one sound to the next. Yes, that was there. Then this now we can see. Initially, that was we couldn't find out because he was not so verbal. That increasing difficulty of longer complex syllables and word shapes. Now, definitely, if you see his video, you will be able to understand that. He used to add a lot of schwa vowels into that. Like, if, for example, when he had to say more, then he used to say more, something like that. He used to say. Even for ball, he used to say ball, like that. Instead of, just smoothly transitioning, there was a lot of addition of different kinds of schwa vowels. Now, yeah, we come to know that his rate of speech is slower than the typical. But when we first diagnosed it, we did not know because he was not so verbal. And syllable segregation, pauses between sound syllables, that affects the smooth transition. That is there. Voicing errors are there. Vowel errors, he had a lot of issues with pronouncing the vowel E. Since the start, it has been really a task to teach him E. But now he's doing good. So we applied this 533 rule in order to differentially diagnose, which was given by Jorim. So in that, what it says that out of these characteristics, if the child, presents with five or more features, and if they do it three times consecutively, or in three different contexts specifically. So yes, definitely at the age of 6 years, when he had first come, he had inconsistent errors, he had vowel errors, he had distorted substitutions, he had grouping behavior, he had schwa vowel intrusion, voicing errors were there. So around approximately 6 to 7 characters we could identify out of this chart. So we finally came to the diagnosis that yes, he has childhood apraxia of speech, because there are other tests also available, like Kaufman test of apraxia and all that, which were not easily available where I was working. So we had to go with this. So even so after diagnosing, okay, the diagnosis part is done that the child has apraxia of speech. That was established. So the major task was explaining the parents and the occupational therapist. After that was also done, we started looking upon that how we are going further with therapy. So first we determine that which vowels in the child's repertoire are there in his repertoire and at which level they are. Like at severe, initial level, final level, what level they are there. So he had basic, and he used to make a lot of sound combinations out of these few 5 to 6 sound vowels and consonants. So first we started with vowel imitation like a, I, U, random vocal play. Then we started with vowel combination like ao, then o-a. Some funny vowel combination we used to make o-o. Then we came to CV. Then we came to CVC. And then finally we are on to sentences now. Next. In order to achieve all this, we had used different kinds of approaches. The oromotor approach, in that we taught him how the oral movements actually happen and how he can go about it in order to produce a particular sound. Articulation approach for him, that articulation approach we had used particularly for the t sound. So we started, he couldn't produce, but he could imitate tongue elevation. Non-speech movements were good. He could imitate those. So non-speech, so we went with tongue imitation, that ta. And then we went to ta 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 ta. And then we incorporated the physical approach and the multimodal approach in order to, bring it into sounds and words, meaningful words. Then cueing approach, visual cues, like how you can see in the picture also, like, how to say oh. And for happy, means E was difficult. So then we use the lip extension like E, and that usually helped him. Prompt we did not use much. It was the least used approach in the entire therapy, but we did use it for one or two sounds, but not entirely we use that. But yeah, main we use is total communication, like whatever worked for the kid. We combined a lot of approaches together, and whatever was he was comfortable with, whichever, like if he was comfortable with the positioning, or he was comfortable with the just me signing how to produce that, so we were going ahead with that. The major, the star of our therapy was the prosodic approach. So we use a lot of melodic intonation, like for ball is there, then we went with starting with ball, like that, in order to make him basically prosodic approach was used in order to combine the consonants and the vowels and make it into a meaningful meaningful words basically. So and also we used a little more of body movement approach, we used to dance around in order to make those sounds. Like if he has to say ball, then we used to like dance like round and round ball, like there's a stop in between, so then you have to stop your movements. So that actually helped him a lot. He could the schwa vowels reduce, and he could make co-articulate very nicely. So that video was in which he uses that cue of E, happy. So now he has reached to a state that where he himself understands that what cue he is supposed to use, and he uses it on his own. So the other areas, like the kid actually loves reading. So we were focusing a little bit on reading, improving his reading intelligibility as well, and phrasing through description, use of words in that are in his repertoire in sentences of daily living. Modeling was going on since the start, at home also, and in the sessions as well. And yes, grammatically correct formation of sentences. He has a lot of issues in grammar, but he's still doing a very good job right now. So yes, the present scenario. So the kid is now able to use, he actually communicates in multiple languages: English, Hindi, Marathi. He is thorough in all the three languages. So this was one more problem that we had to face. Like the other occupational therapists and were actually guiding him that to use only one language at home. It was kind of a blame on the parents, like you are using multiple languages, that is why your kid is not speaking. So it required a lot of counseling to actually, and the family is like, the mother is a Maharashtrian, the father is from UP. So his mother tongue is Hindi, and the mother's mother tongue is Marathi. So they are a multilingual family, but then they stuck to just Hindi. But now the kids speak very fluent Marathi, and even English he can pick up very nicely. So that was also a big fight, a challenge we had to face to explain the occupational therapist and to counsel the parents as well. Actually, I was very new to the parents. The parents had a very long trust of around 2.5 years with the occupational therapist. So that was a real challenge to convey to the parents that okay, whatever you were doing till now, okay, but now we need to change the approach a bit. So but now they are doing okay, and now he follows multi-directional commands, and CVC, see what combinations we have reached. So that's a very it was a very good achievement for the kid. And combines, now he makes short phrases. He has also started imitation of words on his own. Self correction has come, like he understands when he is not saying a particular sound properly, and then he now once just recently he told me that I did not say it this correctly. So then that understanding has also come. His intelligibility has definitely improved, but there's still at level 2 that you need to ask for repetitions what he is exactly trying to say. The main goal was to make him a little independent, and that has come now. Like his ability to communicate verbally and independently has been achieved. So grammatical errors are still seen, but we are working on it. Now he also tries to ask and answer WS type questions independently, and he has started narrating the events of the days. His automatic speech is developed. Initially, he did not have any kind of automatic speech, like days of the week and months of the year, alphabets, numbers. He did not know any of those because actually he did not go to school. So he was not taught anything. But now he is picking up very well. So overall improvement was also seen in his social behavior, and there was an enhancement in his pragmatic skills as well. So this is a video in which he is narrating me the events of his Christmas party that he had in school. See if you can hear it. Otherwise, we'll try to.
It is not audible, huh?
Not audible. Okay, then we'll go for that. Okay. So in this, he still has little additions. If you saw strawberry, strawberry,
Hmm.
like that. So, but so now he has reached to this level. He was still not using sentences this time. But when you communicate like "give me water" and "I want to go to school" or I want to meet mama," "I want to call mama," all those sentences, short phrases, he is able to make now. So now our further areas of focus are definitely to improve his intelligibility furthermore, improve his co-articulatory skills so that it is easier for others also to understand him, enhance his ability to use grammatically correct and longer form of sentences, and to encourage him to be more social and communicative with his peer group. Yes. So thank you. This was the case. I'll stop sharing.
Yep. So I invite the audience to definitely, comment, ask her questions. I'll just start off. Hetal, so when you started counseling and you're telling me for like 2 years they were going to OT sometimes twice a day, 5 to 6 days a week. Did you ask what was going on? This child is nowhere hyperactive. He does not have very obvious visuospatial issues. What was going on for like so intensively?
So I did ask them. So what they said that they saw some progress with the with first 6 months of therapy. But as a child was growing, he started becoming more vocal. Like
Okay.
there was a number of vowels that he was using that has increased, and his
Huh.
non-verbal communication was also becoming better. So for that, then he was not going to school. No school was ready to accept
Okay.
without the shadow teacher.
Correct. So
And
this
they
was parents suppose diverting the funds to OT 6 days a week instead of the
and
instead
they
of
thought
each
that
other.
because they have been guided like that, so he'll become like that. Is what the father said that we were guided like that, so we thought that after 2-3 years of continuous OT, he might start picking up.
Okay, okay, okay. And the non-verbal ones means the gestures basically improved because maybe they worked on the fine motor. So obviously the fine motor imitation,
He got people around him, and
basic
he
stimulation. What
correct,
we
yeah,
say, stimulation.
and
Yeah.
he also he is a very keen observer, so he'll pick up very quickly. So and the group which he was in, they had a lot of non-verbal kids there. So
Hmm.
those kids might be signing or gesturing, and then he picked up and then he started doing that at home as well.
Correct. Correct.
So
So I was wondering. And the other thing, what I really want to congratulate you on that because I think all of us did OT give report of their initial assessment and progress. Dinas ma'am is asking you.
no, I asked. They did not.
Such intensive OT and you did not have any sort of documentation, any
No.
paperwork.
Last
Oh,
I got was when they went to a new occupational therapist who had actually referred
huh.
it to me. So that
Hmm.
came, and then she said that no, we don't want to, like, I don't know, all the sensory regulation and everything is appropriate. He has no hyperactivity, sitting tolerance is good, everything is good. Then you better go to a speech therapist and then let's get back.
Okay, okay,
So they took a third opinion actually.
okay. Yeah, so continuing on the same, what I was telling you, really congratulating you because many of us do this on a very regular basis, and we should be doing it on war footing. Is the exposure to the number of languages. OTs, not just OT, any other co-professional will say that exposed to one language and talk to the child in words. They
Mhm.
don't understand. Talk to the child in one words, two words. That is why when they're coming to you from any other professional and they have not been to a speech therapist, the parent will say, in time, putting it inside, and only then the child is going to pack up. Whether you say pack up or finish, the child is not responding, and they have been guided about the language, like you said. He's getting confused because of
Yeah.
the number of languages of exposure. So did the parents take up to your counseling? Because after 2.5 years, you were changing. Were they ready, eager?
So that is what. So it was a very slow process. So first, what we did is like first I told them the apraxia of speech. I made them understand what exactly is happening with their kid and how we are going to, work with him. Then slowly, after 1, 2 months, they started seeing a little progress, and then I went into okay now you should. Then they used to hear like they could hear what I was doing in therapy. So I used to use multiple languages.
Hmm,
Like
hmm,
थोड़ा
hmm.
इंग्लिश बोल दिया थोड़ा हिंदी मराठी I used to mix up all the languages so then slowly I said see now your kid is picking up this also so it is your mother tongue why don't you start with that
Correct.
so it was a slow process gradually definitely because then I cannot say that what you have been like preaching it is wrong
Absolutely,
that is
absolutely.
not professional like just that other person is saying wrong so it does not look good also and the parents also have to like I have to build a trust first and then I can work over it.
Not professional or ethical. It is traumatizing for the parent because the
So
parent is going to regret it, and they're going to regret to the extent that that is how we wasted our time, madam. That is how we wasted our time.
yes.
So it
Is
is. Huh. No, there is one more message from Dinaz, ma'am. I think it is direct to me. Okay, I'll read it out for you. Very good early analyzing the concern and not wasting time with just general speech stimulation. Good work, Hetal. So, okay. Was any AAC form of communication tried to ease his communication need?
no, initially I tried with him in the first few sessions, but then he picked up verbally quite well. So
Hmm.
then he only switched to verbal. So then, but when we were teaching him, like initial sessions of therapy, the articulatory movements and all that, that time initial I had, advise the parents to use at least some form of board or anything AAC's type of communication
Hmm.
in order to uh, ask him to convey if he wants to convey but he was so good at gestures that he did not need anything else.
I was going to say that you had already mentioned that he has good iconic gestures to.
Yeah, so he did not need anything else. But
So that.
sometimes a few new things, like when he was like, that dance and something that he did not knew the words. Then he
Hmm.
used to do the actions and still people couldn't understand. Then he used to take the help of that, spellings or something like that.
Okay. Okay. Okay.
So he was
That
not
is.
sure he could figure it out on his own that nahi samajh rahe logo ko I should use something else.
I have to put in more efforts to, get the public to
Correct.
understand. So therein proves that he had enough social skills. It is just because the speech output was affected and he did not have general speech stimulation
Correct.
school, he was not getting it. So how was his iconic gestures? Was it at phrase level? Could he combine like two to three things like
Yes.
pointing?
Yes. He could tell you what he did in the day. Like if he ate something and if he ate some fish or mutton or anything, he had those gestures, so he could tell you what he did in the day.
So that is because of observation, and again, that is the social lens or language. So if even
Correct.
though he did
Correct.
not have verbal language, he used something else to communicate. So that
Yes.
differentially diagnoses out a lot of other issues that you
Correct.
possibly
That is
could.
why I thought that he does not have DSL. Like this is not a sign
Hmm.
of DSL because the kid is really like smart and
Yeah,
he's
because
actually social. Just that others couldn't
huh,
understand. That is why he couldn't put it.
he could not.
And then in between, as the pair, like he had actually stopped using verbal words. Like
Hmm,
verbalization was completely reduced because people are not understanding anyway. So people are understanding gestures. So let's go with gestures. It was easier for him.
correct. Because the verbal production was not getting reinforced by the adult
Correct.
responses,
Correct.
basically.
Yes, ma'am. Yeah.
Okay, okay. Huh, so we were talking about the parental trauma. It will,
Yes.
even at 8 or 10 years of age, they will continuously tell you, "अरे अगर वो time नहीं बर्बाद किए रहते ना, our money, the fun." Extremely traumatizing for parents because I also have looked at children who have been to suppose physio or special educator for 4, 5 years, and then when they come to you, the first thing, even if it is intentional, is like, oh my God, why weren't you going to like two, three professionals?
Correct.
Why were you being with one? Because there was trust with that one person.
Yeah.
So, so how is his speech quality now? Like, does he have schwa? How is he making?
The
How is
schwa
the
has reduced. Now he has started co-articulating almost like small into phrases. Like CVC tak he does now. But the
okay,
CVC words have not yet, like multisyllabic words have not yet reached so clearly into sentences.
okay? So there is still a little bit of staccato when he's trying to generate a sentence, basically.
Like
But
that's what he uses. Then he was using gestures also. If you could see like khalla khalla
uh,
like that. And
happy
E,
e,
happy,
happy e. Correct, correct,
yes. So like
correct.
that.
This is very similar to speech of children with a hearing device.
Hearing
You
the,
know?
I was,
Yes, yes. Because sorry, I lost internet.
oh, okay. Yes. Yes, ma'am. Saying
Yeah, I lost internet. I lost internet. So,
you was
yeah, yeah, we were talking about that. It is very much like, it's very, very much like children with hearing devices when they are finally able to put words and phrases together.
yeah. So first when he came to me, I thought of like he has hearing loss. That
Ah,
was ruled with the
hmm.
so then that we actually went with exclusion diagnosis like criteria. This is not there, this is not there, this is not because
Ah,
um,
yeah, yeah, तो ये तो yeah,
mom has asked a question like how are his writing skills.
hmm.
So his writing skills, he could can write things when at first, but with the remedial and everything, he can actually write into small words and form sentences and like. So that is also improving. Initial spellings.
का अच्छा है, अंडरस्टैंड वेरी वेल, तो
Apraxia है मतलब that is diagnosed.
यस मैम,
You can actually think of मतलब two level पे he use on his own or he needs help.
ही सर,
He needs help. तो same way expression technique so use that to limit as tense. Now you are working on phrase like
करेक्ट,
so picture description helps. When in your anxiety with others, start with group sessions. Maybe with one or two kids, not a lot of kids. One or two, you are monitoring the session and you are helping him, how to communicate and how to gel up with the peer group.
ओके
What are the like basically just guiding, modeling him that what he has to say in a particular situation.
ओके श्योर मैम,
So you can try that. And usually picture description and for me, I don't use very structured approach. I go with the kids. So we play with the K or any, then whatever the child wants to, speak and then I just extend the sentences. So that of the kids, like usually they pick it up
Sure.
and then they
Okay.
use the same at home. So you can try that also.
But we use
Like group therapy हो गया या तो फिर कोई ऐसा situational play हो गया.
sure,
That you
ma'am.
can try. So that basically generalization is a problem for him. He knows how to say, but he's not using it in general communication.
Okay, thank you, ma'am. Thank you so much.
The dance that you mentioned, that how was that is it, the dancing that you mentioned, it definitely is going to help with the co-articulation and the to throughout the schwas in between. Basically, even the melodic intonation, it is supposed to help the carryover to for better co-articulation skills, basically, because they take each sound to be so discrete in nature that it is very difficult for them to put it in a sentence, and the system is itself is so difficult. So even if they have to say I am happy, they have to remember so many cues to
Many,
get each
yeah.
of the articulated
Yeah.
positions, you know.
Yeah.
That is good. But I think his reading and writing as a as skills will definitely help him as a strength, right? So
Mm.
it's easier integration for the school also, even though at that age there are a lot of oral exams. But I think the reading and writing will give the schools the confidence that at least cognitively, CS as a problem, I don't know where it starts in the neurodivergent fabric, but definitely given the play and the writing, it gives the school the confidence that we can take the child. It will not be
At least, हाँ.
such a big issue, basically.
Yes,
Okay,
we are
okay.
hoping that.
I did not have power, so I hope you had a good conversation. You had a good discussion by them. I was trying to switch internet, so I think by the time you had a good discussion with the audience. So is there
Yes,
anything
yes.
else you want to share or this thing, especially about the OT or anything else, or should we wind up? Tell me.
Yeah.
Okay. A general question to the audience, so that if anybody has such a kid, you can contribute and participate. Have you worked with such a kid for a long duration of time, especially if there are experienced clinicians over here? How is the story 10, 12, 15 years later when you really need the child to be independent? We have really expert senior clinicians with us in the audience today. So if anybody can shed some light on it. Even I have worked maximum up to 3, 4, 5 years, because like you said, if it's really genuinely a idiopathic case, then they get in a regular mainstream school, and once the reading, writing, or even basic speech is up to the mark, they don't really come, basically. So okay, so let's see. So thank you, Hetal, for making this interesting, because like every other differential diagnosis we see, it is fun to work, and it is fun to use these techniques, because it is not that you're working with some kind of pattern, some kind of play. You were truly able to work with the speech in a very, very nice and organized manner. So this is a small token of love and appreciation. I'll be sending it to you personally. Thank you so much for your time and constructing the case so that we could discuss, basically. And thank you
Thank you for the
everyone.
opportunity.
It Please, we are looking forward. If you have any other case with any other diagnosis, I will be more than happy to host you. So anybody, because it's an all SLP forum, I request you to take up cases which you have worked for more than a year, where you can talk about your techniques and everything, and we can have this discussion over here. I'll quickly show everyone, all the audience members that we have here today. I'll just show you the website which is in place right now. So this is the Insightful Ped SLP website that we have. All the case discussions till date are available in this blog section. So if you see, we have Aisha ma'am's the latest one, followed by all the previous ones which are here, even the one that Hetal presented today is going to be put up over here. And in the courses section, we have the paid ones. Just give this a second. We have the paid ones where these are stored. You can, if you have not, participated, you can still purchase it and go through it. You are going to have lifetime access to these courses. We just had a panel that we had exploring living and care options for parents and adults with special needs, oromyofunctional and anxiety management. So these are there with, you can have a lifetime access to these. And on 10/10, I'll just see if I can pull up that image. On the 10th and 11th of Jan, we have fundamentals of phonological awareness skills, which is going to be conducted by Neha Tiwari ma'am. It is not going to be available as a recording. She's going to show a lot of her copyrighted stuff. So I do want to encourage you to participate in person. Okay, it's going to be a live session for 2 days, 5:30 to 7 on both days. And both, it is meant both for parents as well as professionals to fine tune our skills of phonological awareness, how to train these in children. And it is meant both for neurotypical as well as neurodiverse kids. It's a skill. If we learn it, it's how we apply it. So just wanted to share the upcoming events. If there are more, I'll be putting it out in groups. Thank you so much. Thank you for participating in this on a Saturday evening. Thank you, Hetal, for working up the case, getting it to the forefront. Do feel free to work on any different type of cases and bringing it. It is a sheer pleasure to be discussing with SLPs and getting these kind of inputs and feedback. So thank you, everyone. Thank you so much. I think we'll wind up now. Is there something in the chat box? Yeah. Children on the spectrum very often show symptoms of CAS. Comment, Hetal?
Yes, even I read up studies on that. There is a lot of overlap of autism spectrum and CAS. But then again, because there's an overlap, we cannot the differentiation becomes a little difficult. But this case was like pure CAS, no other comorbidities. So then
So that is why you could work on, the
specific
yes, we
approaches.
have
Yes.
studied.
The approaches with autism changes.
Absolutely, because the play pattern is different. You might have a hyperlexic kid or a kid who refuses to identify ABCD at all. Because she mentioned this, Varsha ma'am mentioned this, I would also like to bring into focus that children with dysarthria. So if you specifically look at the children with cerebral palsy, if you look at the motor involvement group of kids, they also have CAS. We just look at dysarthria, like she was describing in the beginning. We just look at the dysarthria, but even with dysarthria, you're going to see um, significant issues in production upon demand. You have worked on the exercises, you are working on the dysarthria. So in dysarthria, you expect that irrespective of the poor quality, when demanded, they will produce something, right? When you're demanding, if it is a pani is a mugger, they will always say a mugger instead of pani. Okay, that doesn't happen. A kid who is not doing that in dysarthria, definitely it does have an overlapping component of CS as well. There are very few studies right now, but there are studies which are saying that even in children with dysarthria, don't rule out CS, because then we put up a lot of performance pressure on them, that you know this production, like even a mama is a mama, even there are times they are not even able to do that, and you have to cue them a lot. I'm closing my lips to see the man. Then you know that even with dysarthria, especially children with motor involvement, they do have a CS component as well. So more comorbidities and this thing, they have a lot of overlap basically. So thank you so much. I'll put this up again for everybody. Thank you so much for participating. Thank you so much for making it so interesting. Do visit the website, catch up on the previous ones. Hetal's, I will make that available also in a couple of days. So thank you, Hetal. I think we'll wind it up. Thank you for your time and the presentation. It was absolutely lovely. Okay. Okay.
Yeah, thank you.
Welcome.
Have a good weekend.
Everybody, yes, have a good weekend ahead. and a good and a happy new year
Happy New
ahead
Year.
too.
Happy New Year.
Okay,
Bye-bye.
okay. Bye.